My name is Joanie Carlson. I'm the medical student that was assigned to take care of Mrs. Romanoff on the labor and delivery unit on the day that she died. I saw her and her husband on that day, and I remember it was a very, very busy day. Dr. Feldman had already taken care of several cases that day, and he had several more. So he asked me to take care of Mrs. Romanoff. Well, he told me to take care of Mrs. Romanoff. All I really knew about her pregnancy was that she was 39 weeks along. Well, maybe 42, depending on if the ultrasound was correct. And the nurses had said that they saw some D cells on the monitor, but they weren't sure because she was moving around a lot. So maybe it was artifact. Well, when I went into the room, I saw Mr. Romanoff. He was trying to comfort his wife. She was in a lot of pain. And when I looked down at that monitor, I knew something was wrong when I saw all those D cells. And I just ran out of there and I said for someone to please page Dr. Feldman. Well, within minutes, we wheeled her into the operating room. And Dr. O'Leary was a surgeon in the operating room. Things were very tense, and he was just real tense that day, and Dr. Feldman was trying to tell him that there was a possible abruption. But he said he already reviewed the case, and he was telling the anesthesiologist, Dr. Becker, to go ahead and sedate her because Dr. Becker was unable to get the spinal to work. The spinal wasn't working. And Dr. Becker did not want to rush into sedating her because she had a class 2 airway. But Dr. O'Leary just kept saying, we need to get her sedated. We need to get the baby out. Well, because the baby was showing the D cells and the bradycardia. And so he went ahead and he made the incision, and Dr. Becker was trying to get her oxygen levels to come up and trying to intubate her, but he was unable to intubate her. So that's when the code team was called. And when they did finally get there, it seemed like forever, but when they did finally get there, they placed an emergency tracheostomy. And really all I remember is there was a lot of blood. Mrs. Romanoff was bleeding a lot. The baby was okay, but Mrs. Romanoff wasn't. And I just keep thinking that if only Dr. O'Leary would have listened to Dr. Feldman about the abruption, but then I think maybe I probably should have just called a code right there in the labor and delivery unit, and maybe Mrs. Romanoff would be okay today.